Think prevention, live long.
This video I made to explain to you what diabetes can cause in terms of heart attack and stroke. People who have diabetes, I take them as if they already had one heart attack. Matter of fact, we have enough of a data, enough of a proof that once a person develops type 2 diabetes, they behave just as if they already had one heart attack. So it's a very, very serious condition once you have type 2 diabetes. Many doctors and people with diabetes don't realize that all diabetics die from stroke and heart attack, not from the sugar. So I've seen consistently over the last many years that a person with diabetes will know all the details of their sugar, but will not know in detail about the blood pressure, cholesterol, and that leads to the heart attack, stroke, dialysis. So if you have diabetes, let's make sure that your blood pressure is controlled 130 or 85. You are on certain type of medication to control the blood pressure, which will protect your kidneys. You are on a statin, the cholesterol medicine, because once the diabetes is diagnosed, regardless of cholesterol numbers, you need to be on statin. So even if you have a low cholesterol, quote-unquote low cholesterol, we know that type 2 diabetics behave like a person with heart attack, and they pretty much, as a standard, get cholesterol therapy in the form of statin. Make sure you're on aspirin because of preventing stroke and heart attack. Make sure your cholesterol is checked periodically. Make sure your leg circulation is checked. The neck blockage are watched, observed, and cautiously monitored. Many diabetics will develop weakness of the heart muscle, and heart failure is watched very closely. So to sum it up, diabetes is very, very concerning risk factor in terms of developing heart attack, stroke, peripheral arterial disease, dialysis, amputation, loss of vision, blindness. And let's just make sure that if you have type 2 diabetes, we prevent all the complications. I'll work with you, I'll work with your primary care physicians, and we'll make sure that we avoid any hospitalizations and any major morbid complications. So let's work together in terms of preventing complications for diabetes. Thank you.
When we think prevention, live long. The heart of mid-Michigan strong.